We're here today to talk about co-producing our communication strategy. In the room today, we had patients, carers, members of the public, healthcare professionals and researchers that are all involved in the Patient Safety Translational Research Centre.
Co-production, I think, is the working together of different stakeholders towards a common objective.
We actually co-produced the actual agenda for the day with one of our service user lay representatives, and Sandra was able to give us an overview of what co-production is and made us think about how we could co-produce differently.
It's genuinely sitting down as equal partners with a language that everybody can understand and producing something that will be better and more effective in the future for patient care.
And then we moved into discussions about communication and the how, where and why we should communicate with different people, different groups, different mediums.
So I found today really useful. It was really good to have the opportunity to input into this strategy along with our patient and other partners.
I think today has actually helped me to think and also value the importance of communication strategy and involving people in making decisions on different types of communication strategies.
We came together after that to share our kind of final thoughts and thought about actually what were the take-home messages from today and how each of us had benefited from participating in this co-designed event.
I found today really interesting. I'm glad I came. I've learned a lot more than I realised. It's good to see more people co-producing things together.
This has the potential to be really effective work in a really interesting area. So the more that it can be communicated, the better.
So today went really well. It was really good to see a diverse group of people come together with very different views and backgrounds, and for them to come up with ideas that we'll be able to practically use within the Patient Safety Translational Research Centre.
So I think we have rammed home the lesson of patient-centeredness being the essence of how any professional should conduct their work. And I feel buoyant about it.
I think this is the start of something new for the public and for stakeholders to be engaged in.
But of course there are barriers. But aren't we here to meet barriers? Isn't that what life is about?